what advice would you give to the audience as they start? Not everyone's where Kaiser is, not everyone's as Wlsa is. Where do they start? What should they think? What should they be thinking about? How do they get involved? They can't fight it. They can't hide it away from it anymore.
Right.
What's some advice to them?
I think the most important thing to realize is sort of the lesson of Kaiser as a whole, and that is that integrated care and integrated delivery offers opportunities that are unavailable absent that level of integration. And the same is true of your mobile strategy. So to the extent that there's over 13,000 health and wellness apps in the Apple App Store, to the extent that the uptake is fairly limited to date, there's a signal in that noise. And the signal, in my view, is that there isn't a sufficient level of interoperability at three levels. One, modular architecture, open architecture. Second, at the semantic interoperability, both between the health record data, the personal health record data, and the app data, as well as between the consumer terminology and the professional terminology. And the third level is behavioral interoperability. So the problem we have today with the disorders of lifestyle is really centered around behavioral issues. And so to the extent that we can create a behavioral symphony of wellness that helps bring about convergent cues so that it makes it much easier for us to do what we want to do in achieving our own personal health and wellness objectives. And so there isn't going to be a single killer app. It's going to be an ecosystem of apps that interoperate at those three levels of platform, semantics, and behavioral interoperability. And so as you think about creating your solution set and your strategy, I think it's really important to look at the interoperability and the ecosystem approach as opposed to the killer app approach. And that's why I've been very active with the Open mHealth initiative. I've recently joined their advisory board because I believe that they're at the leading edge of creating the foundational standards for interoperability amongst different health and wellness applications.
So, you know, as a physician, why do you think a lot of physicians are not jumping on the bandwagon of getting involved in delivering apps or, you know, mobile health to their patients? What's the hesitation?
So there's a misconception that's urban legend that physicians are reluctant to adopt technology. I think you can go into any operating suite in the world and see that they embrace new technology very quickly. The challenge is that operationally they're under such extraordinary time pressure, and what's happened with this exponential growth of data is there's what Peter Diamandis of the X Prize calls the disruptive stress gap. So what's occurring today is that there's more and more demand on every physician at every encounter to accomplish more and more stuff. And so they're kind of overwhelmed with the incremental addition of new stuff. What we're talking about in the mobile digital revolution is transformational. And so we're not going to get there incrementally. And so in the mind of the typical physician, they're stuck in how do I incrementalize this thing, and it looks like mobile apps are going to represent more work on top of the incremental adds, as opposed to a disruptive change that can substitute for some of the work that occurs where the physician lives and push some of that out to where the consumer lives and actually decrease the disease burden and the demand on services. So this really is a disruptive change, and there will be a tipping point, but we're stuck in the incremental mindset at the moment.
So with my Happtique hat on, and you know, we believe in, you know, certifying apps and curating apps, but we really are all about prescribing apps. Do you think the day is going to come when institutions will have an app formulary and physicians will be prescribing? And when I say apps, I don't mean just apps, connected, you know, devices.
And we actually have a project called Designing the Office of the Future as primary care redesign, and there's a lot of focus around telemedicine, which I think is an utterly obsolete term. And it's my belief that instead of having a telephone in every examiner in every office, there would be full video capability. There are already institutions that are doing this, and we're working on it. So there's no need to think of this other than video dial tone instead of conventional dial tone, to bring together the patient, their mother, their personal caregiver, their cardiologist and physician real time.
Love it.
And that's going to be profoundly transformational. To your question of what are we going to do with the app prescriptions, I believe that the significant new role that must occur within our walls, more or less, is when you prescribe a suite of apps for an individual that fits within this ecosystem, you need to get them initiated. Once you get people initiated to apps that have a good behavioral framework, they will stick with it. But I believe that we need to have the capability in the office, when the apps are prescribed, to set people up on their smartphone or smart pad with the apps, get them started on it, and then with each return visit say, how is it going, review, and then begin to mass customize the behavioral levers within each of those apps to drive them towards the behaviors that support their own personal goals that they commit to.
I agree 100%. It was like music listening to you say that. My last question for you, what's your favorite app? And it doesn't have to be a healthcare app. I ask every guest I've ever had on the show, what are you into these days?
By far and away, Pandora. And you know, there's a book called Musicophilia that describes how our brains are so attuned to the appreciation of music. And what Pandora does, if you don't use it, is apps. It's called the Music Genome Project. It allows you to create your own music stations. And to the extent that it's mass customized to me, it represents one of the early progenitors of avatars. And so what we're going to see is multifunctional avatars across our entire interaction with the universe. And Pandora, I think, is really a forerunner of what's to come in healthcare and essentially every vertical. And these will become the primary sales and marketing channel for everything. And so that's why Pandora, to me, because of the music aspect, is my favorite app. It also represents, I believe, the future of all communication through mass customization.
Your passion is amazing. I'm like awed to be able to interview, and thank you for being on the show. Have a great rest of the show. And my last question, so for the audience, at Kaiser, are you open to, there's developers who listen to our show, and are you open for new ideas?